Hello everyone, my name is Mohit Arora and I'm one of the postdoctoral fellow at the University of Sydney, Australia. Today I will be talking about skin integrity and what are some of the key considerations that we all should be aware of. Please note the strategies outlined in this presentation are for general information only. Clinical advice specific to your spinal cord injury, personal or unique lifestyle should be directed to an appropriate healthcare professional and services who have the skill and expertise in managing people with spinal cord injury. These are the learning objectives for my presentation. At the end of this presentation, you will be able to understand what is a good skin integrity and the impact of daily skin checks, different types of clothing and shoes, different skin products, as well as impact of bowel and bladder incontinence on the skin integrity. As we move forward, you will see that after each of the learning objective slide, I will be presenting some of the take-home message or tips. Most of us are aware that the common causes that directly relates to skin integrity issues are immobility, sliding down a chair or bed, pulling across a chair or bed, and irritation from sweat or other bodily fluids. And we will explore some of these as we move forward in our subsequent slides. Our first take-home message is one of the most basic need for people with spinal cord injury is to maintain an intact, healthy, and moisturized skin. The first factor I would like to talk is about skin checks. Use your eyes and hands to check your skin carefully. Do this at least twice a day, once in the morning and once in the evening. Pay special attention to common sites that are prone to pressure injuries, for example, bony prominence. Keep your skin clean and dry all the time, especially after showering. Pay special attention to groin between the buttocks and in between your toes. Use of long-handled or adaptive mirrors or teach another person for examination. Always make sure if another person is doing this for you, they inform you of what your skin looks like and even take a photograph to show you. Touching the skin is necessary as well as inspection to detect early changes in the skin, which may be indicative of skin or deeper tissue damage. Remember, the only way to know if your skin is healthy and intact is to look at it. There are some other considerations that you should keep in mind. There may be times when you need to check your skin more frequently. For example, if you have fallen from a chair or let's say knocked your leg against something, it is important to check your skin as soon as it happens, and then 30 minutes later to check if red marks have appeared. Area that need special attention are groin area, behind knees, the area around your ankle and elbows, your sitting bone, hips, and tailbone. Be aware of what your skin normally looks like. The second factor is related to clothing. Choose appropriate clothing. Avoid clothes that are too tight, including shoes, socks, braces, and leg back straps. Clothes that are rough enough to cause skin friction. Clothes that have thick seams, buttons, zipper that press on your skin. Clothes that have had studs, fasteners, and double welted seam or can hold heat for longer time are usually not recommended. Cotton material is best. Other special consideration is avoid sitting on seams and back pocket. Over tightly clothing can hinder circulation, which can increase the chance of pressure ulcer development. If the clothing is too loose, it can bunch up or wrinkle in the area where there's no pressure on your body. If you're wearing a new clothes or shoes, you may want to wear them for a short period of time to see if they fit properly or if they're not marking your skin. The third factor is related to skin product. Clean and dry your skin as soon as possible. When you have been sweating and your bowel bladder accident. Traditionally, alkaline soaps and water have been used for skin cleansing. However, these methods have been discouraged. As alkaline soap change the protective acidic mantle of the skin, which we will see in our subsequent slides. However, soaps and other products that dry out your skin, such as contain perfume and alcohol, should be avoided. In people with incontinence, to preserve the integrity of skin, the application of leave-on products with skin protecting and moisturizing property is recommended. So what I've done in my next slide is presenting you with some of this leave-on product information, which you can always go back to your healthcare professional and check what is the best like product for your circumstances. So leave-on products are something which when you put like on your skin, they keep for longer period, and we usually divide them in three groups. The first group is what we call in layman is emollients, which replenish the natural moisturizing factor. The second group is ceramides. They are like lipid type structure, which are also present in one of the skin layer, and they usually helps to retain moisture and allow proper function in the skin barrier. The third group is essential fatty acids, vitamins, and antioxidant, which are also present in a healthy skin, and they are the building block of healthy skin membrane. So the take-home message will be to understand the right skin product for your circumstances, and you can always go back to your health professional and talk to them and know what is right for you. And it's also important to understand that there are some medication which makes your skin sensitive. Like for example, like baclofen, which I'm aware that some of the people with spinal cord injury takes for the spasm, that can make your skin sensitive to stun. So being aware of those type of other factors is also important to maintain good skin integrity. Okay, for the last factor which I want to talk a bit about is bowel and bladder continence and on your skin integrity, because I think it have like a significant impact on your skin integrity. It will be good to understand how. So our normal skin is slightly acidic in nature, which is measured as pH, and the normal pH of skin is 5.5. A pH of 7 is neutral, and anything below 7 is acidic, and above 7 is alkaline. And we want our skin to be slightly acidic, which is 5.5. So when your skin is exposed to urine, or it exposed to like a stool in incontinent, people with spinal cord injury, it raises the pH of the skin to more alkaline range, and this increases the hydration capacity of the outermost layer of the skin and make it more hydrated and soft. And that makes the skin susceptible to absorption and penetration of potential irritant, and ultimately reducing the barrier function of the skin and making it prone to infection. So it will be good to understand the mechanism of why bowel and bladder incontinence can have a big impact on your skin integrity. The other special consideration I would like to talk is also distinguishing between a dermatitis, which is like related or associated with incontinence, which we have just talked about, and differentiating that from pressure injury. And it is like, as I said, like incontinence associated dermatitis is a common problem in people with spinal cord injury who have bladder and bowel incontinence. And it occurs in about 27% of people who are admitted to hospital. So like how we say, like usually like in people who have bowel incontinence, the fecal like remains or feces contain harmful enzymes that break down the skin barrier and allowing bacteria and fungal growth. Similarly, in people with urinary incontinence or bladder incontinence, the urea which is present in the urine can change the skin environment and encouraging bacteria to grow. So just like a quick point on that, like a quick tip, how we can distinguish incontinent related dermatitis versus like pressure injury, which is more related to pressure, is usually dermatitis lesions are linear in shape and commonly found in the fold of buttocks and are usually associated with moisture, as we were talking earlier. So the take-home message for this particular learning objective, that it is important to maintain a good bowel and bladder routine to prevent urine and feces leaking into your skin and causing irritation. So these are like some of the useful resources, and I highly recommend the first one, as it is co-designed consumer tool from consumers. It is freely available and can be accessed by typing the hyperlink on the web browser. Thank you for your participation and listening to my presentation.